paper that I wrote from an experience I had down in London when the pandemic first began. And the title of the paper is there a benefit in using non-steroidal anti-inflammatory drugs, Ibuprofen and Naproxen, in the prevention of cytokine storms in the treatment against an individual who was affected with Covid-19? Okay, let's begin. The aim of this manuscript is to summarize, synthesize, and evaluate the benefits of using non-steroidal anti-inflammatory drugs in the prevention and treatment of a patient who is in acute respiratory distress, suffering from a cytokine storm resulting from becoming infected by Covid-19. This will be achieved by looking more in depth into key concepts through analysing different data collected from different studies and other variable resources, while also looking into what factors can affect the healthcare workers' decision-making process during the stressful times of a national pandemic. It will also look at the benefits of adopting a more holistic approach towards Covid-19 patients, rather than using an outdated biomedical model in the management and treatment of an individual who is affected from Covid-19. Wright states that NSAIDs have become a detrimental therapeutic agent where the primary mechanism of action is the inhibition of synthesis of prostaglandin from the arachidonic acid. According to Sherbel, NSAIDs are known to manage symptomatic relief by applying a moderate analgesic and inflammatory effect. Furthermore, Wangrapenik states that NSAIDs are vastly effective in the treatment for pain and inflammation, with the prevalence in the use of these drugs in patients over 65 years of age, approximately 96% in the practice setting. However, Davis and Robson explains that NSAIDs are known to cause adverse drug reactions, which are responsible for approximately 30% of hospital admissions. For adverse drug reactions mainly due to GI bleeding, heart attack, stroke, and renal damage. Moore reiterates that adverse drug reactions mainly occur from NSAIDs use due to interactions with a concomitant medication, such as aspirin, antidepressants, and other commonly used medications, and as a result, consideration of the dose and duration of NSAIDs use is vital when using this type of medication. According to Kaufman, approximately 1 in 30 patients are likely to consult their general practitioners for adverse drug reactions that have been associated from taking this type of drug, which highlights the importance of where GPs should take this occurrence of adverse drug reaction risks into account when deciding whether treatment with an NSAID is appropriate.
In December 2019, China notified the World Health Organization of several cases of human respiratory illness, a disease later named Covid-19. The virus causing this disease is known as severe acute respiratory syndrome coronavirus 2. The disease spreads through small droplets that are expelled from the nose or mouth when a person with Covid-19 coughs or exhales. Therefore, standing close to someone who is infected can put you at risk. These droplets can land on your hand and be transmitted through something as simple as a handshake, if afterwards you touch your eyes, nose, or mouth, the so-called T-zone. The virus is known to survive on different types of surfaces, so touching these contaminated surfaces and then touching your T-zone brings a high risk of infection. What we know so far: the coronavirus is spherical in shape, and its genetic material is encapsulated by different types of proteins. Some of the key structural ones are spike S protein, the most prominent feature of coronaviruses from where they get their name, then M, or membrane protein, and the so-called envelope protein.
December 2019, the World Health Organization was informed of a cluster of cases of pneumonia in Wuhan, China, which is now known as Covid-19. According to Bedford, the World Health Organization CITREP 55 report mentions that the primary goal of managing the Covid-19 outbreak was to use a self-containment strategy in the hope that it would delay the onset of patient surges where possible. However, according to Public Health England, as from the 8th of April 2020, 60,773 people tested positive for Covid-19, which has now reached 7,097 deaths in the UK alone. According to the Medicines and Healthcare Products Regulatory Agency, the severity of Covid-19 can range from mild to critical, where mild and moderate symptoms affect 81% of people, severe symptoms affect 14% of people, and critical symptoms affect 5% of people. According to WebMD, the virus enters the body and attacks healthy cells. Specifically, they burst into cells through ACE2 receptors. Once in the cell, they hijack and take command, where it then multiplies and eventually kills the healthy cell, which in time will cause the lungs to become inflamed. And pneumonia will set in, making it harder for the person to breathe, which could then potentially lead to acute respiratory distress syndrome.
The Ebola virus is a highly aggressive virus that is transmitted through bodily contact with an infected, symptomatic individual. The Ebola virus enters the body primarily through direct contact of mucous membranes, like the eyes, or through abrasions in the skin. When inside the body, the virus fuses with tissue cells, invades them, and releases its genetic content into the cell. This is similar to many viruses, wherein the viral RNA uses the host cells to generate copies of itself. The genetic material takes over the cell machinery to replicate itself. New copies of the virus are formed, released into the system, and dispersed. This also causes the cells to explode, sending infectious particles flying. Ebola then overpowers the immune system. The very cells that are meant to fight infection are used as carriers to spread infection to other body parts, including the liver, spleen, kidneys, and brain. The virus attacks almost every organ and tissue in the human body, resulting in an overwhelming inflammatory reaction. This is what causes sudden flu-like symptoms that are the first signs of Ebola.
Ruthen and By-Ray-Reddy state it is also crucial to note that there is similarities in the symptoms between Covid-19 and earlier beta coronaviruses, such as Ebola virus disease. Patients infected with Covid-19 showed larger leukocyte numbers, abnormal respiratory findings, and increased levels of plasma pro-inflammatory cytokines. According to the World Health Organization interim guidance, Ebola virus disease affected West Africa in 2013, infecting over 30,000 people, resulting in 11,000 deaths. Reynolds states that ibuprofen can help disable the disease by being able to bind to the protein on the surface of the Ebola virus disease and disable it. Gallagher reiterates on Reynolds' statement by adding that scientists have said ibuprofen can bind to the most crucial Ebola virus disease, which it needs to infect cells. Lewin states the French health minister Olivier Véran believes that ibuprofen could be a factor in aggravating infection in patients with COVID-19, as they hypothesize that NSAIDs can cause the ACE2 receptors in the body to broaden, which could allow the infection to gain entry into the cells quicker and easier, thus making a person a lot worse. However, according to Kalata, who mentions that Dr. Barry states that COVID-19 is a new pathogen and not much is known about the disease or how it will respond to common medications. But there is no research, no data, or no reason to think an infected patient should temporarily avoid the use of ibuprofen. Furthermore, Koala goes on to say that Dr. Fitzgerald agrees with Dr. Barry's statement by mentioning that there is no evidence and no reason at all to issue public health guidance on the use of NSAIDs with COVID-19. But there are reasons, however, to be concerned of patients with long-term use of NSAIDs, as it could potentially increase the risk of kidney disease. Day states that doctors in Italy have had success treating severely ill patients with COVID-19, as it helps block the key inflammatory molecule interleukin-6, and there is a theory that ibuprofen may prevent cytokine storms, in which the immune system starts attacking itself in seriously ill patients and can result in organ failure. Fisher mentions that Dr. Young states there is no evidence where ibuprofen can cause a patient with COVID-19 to get worse, although there is circulating misinformation to that effect. The World Health Organization states there is no strong evidence that ibuprofen can make COVID-19 worse, and those who have been advised by their healthcare professional that should not stop using them, with them now stating they don't advise against the use of it, but would recommend using paracetamol for pain and fever first. Exu mentions that corticosteroid treatment is not routinely recommended for COVID-19. However, according to the pathological findings of pulmonary edema and hyaline membrane formation, corticosteroids, along with ventilator support, should be considered for patients who are presenting severe symptoms in order to prevent the development of acute respiratory distress syndrome. Healy mentions that Kellel states there are evidence of harm with corticosteroids in people with COVID-19. However, there is none with ibuprofen, which acts on a weaker scale than steroids to suppress inflammation. Delia states that some influenza viruses can trigger life-threatening cytokine storms, which can ultimately result in death, as the immune response can be vital to the patient if cascades are not properly controlled. Delia goes on to say that effective treatment is balancing the inflammatory network for post-symptomatic infections, which can be achieved using NSAIDs, as they modulate rather than upregulate the immune response via the cholinergic anti-inflammatory pathway, COX-2 pathways, thereby damaging the positive feedback loops of sepsis and cytokine storms, which could prevent patients from dying. According to Murphy, certain drug treatments could help prevent cytokine storms. Anti-inflammatory drugs has never been successful in the treatment of cytokine storms, thereby not improving the survival rate. However, Liu further reiterates on Delia by stating that drugs with anti-inflammatory properties inhibit the COX-2 enzyme, whereby improving the chances of survival of a patient who is infected with influenza.
The biomedical model of medicine has been around, according to the biomedical model, has been around since the mid-19th century as the predominant model used by physicians in diagnosing diseases. It has 4 core elements. According to the biomedical model, health constitutes the freedom from disease, pain, or defect, making the normal human condition healthy. The models focus on the physical processes, for example, pathology, biochemistry and physiology of a disease, does not take into account the role of social factors or individual subjectivity. Unlike the biopsychosocial model, the biomedical model does not consider diagnosis, which affects treatment of the patient, to be the result of a negotiation between doctor and patient. The biomedical model of health focuses on purely biological factors and excludes psychological, environmental, and social influences. It is considered to be the leading modern way for healthcare professionals to diagnose and treat a condition in most Western countries.
Zoe Kefley states that in order to improve healthcare delivery, patient-centered care must apply, especially when making informed decisions based around the healthcare worker's autonomy. Castell states that there are factors that affect fear repercussions when adapting patient safety initiatives, especially when there is a lack of leadership. Smile Hodzik states that certain things that are posted on social media can have practical implications on healthcare providers and policymakers within the healthcare setting. This further supports Fisher's statement that relates to the French health minister's post on Twitter, as it caused circulating misinformation to take effect. Jackson states that fear within leadership can cause risk aversion, indecisiveness, and procrastination. According to Nibbling and Brewer, nowadays a nurse's decision-making process can be influenced by modern-day technology, rather than investing time to support higher-level and more holistic decisions that are based on a deeper understanding of the individual patient responses. Boanecki and Boateng explains there are various factors that can affect the collaboration between nurses and doctors, such as the doctors perceiving themselves to be a more powerful and competent, and as a result nurses are ignored in the decision-making process, as they are regarded to have no authority. Draper states that healthcare workers perceive the threat of working during a pandemic influenza daunting, as they are worry about their loved ones, along with the barriers to working such as a team and organisation. They work within relating to leadership and trust. Grissinger explains that all healthcare workers should know the 5 rights of drug administration, which include right patient, right drug, right time, right dose, and right route, which is the gold standard in safe medication practices. Freytag states that medical errors through lack of teamwork has an incidence of 9% and could lead to worse patient outcomes. It seemed that the different members of staff in the hospital were adopting the biomedical model when treating COVID-19 patients, as Wade and Halligan states that the biomedical model is there to improve organisation of healthcare. However, it does not run on the assumption that illness is secondary to disease. Singh explains that the NHS adopted the traditional biomedical model of healthcare many years ago, which does not fully meet people's needs today. Serkio and Brackey further mention that stigma can come with the biological model framework, which can cause issues when assessing and treating patients, whereas Zamanzadek states that the holistic care model recognises the individual as a whole, which includes a wide range of approaches including medication, education and treatment. Roca explains that during a pandemic, despite the potential of vaccines in curbing the menace, it is vital in strengthening of existing health systems, and functioning health systems must take higher priority. During difficult times, such as an influenza pandemic, it's possible for healthcare workers to lose confidence in their leaders, which can have an impact on their teamwork. This can result in poorer patient outcomes, as less preventive measures will be put in place. NSAIDs, such as Ibuprofen, had a massive impact on the Ebola virus disease, which also happens to be another type of coronavirus, as is Covid-19. By following the 5 rights of drug administration, NSAIDs can be used at the right time, where it has little to no impact on the virus itself, but where it could prevent the patient from suffering the full effects of a cytokine storm. The fear of making a mistake is possibly causing hesitation within the healthcare setting to utilise something that may very well have a massive impact on this type of coronavirus, where it could save many lives. Healthcare workers need to do their best to follow guidelines, work as a team to improve patient outcomes, and to follow the leadership of their organisations. However, the healthcare system is using the biomedical model in the management and treatment of patients during this pandemic. This is causing them to focus on the disease and less on the preventive measures that could be used to prevent patients getting worse. The healthcare system needs to put the patient's care needs first, individual patients, by using a holistic approach and treating each patient as an individual. I just want to say thank you very much for being here, and I hope you all enjoy the rest of the conference. Be safe, take care.
Well, thank you very much, Carl, for this really good presentation. And it actually took me back yesterday to the keynote speak from Dr. Farouk Mirza from Toronto, Canada, who talked to us also about the importance of leadership, and you just basically undermined this with your models that you presented to us, and how important it is that you have the possibility to actually speak up if there are any errors or if there are any mistakes made. And I think you echoed that very, very well in bringing it to us today again. So thank you very much, Carl, for your excellent talk today.